Hey guys, my name is Lisa Thompson, and this video is going to be about POTS, which is postural orthostatic tachycardia syndrome. It's true that a lot of people can have symptoms of this disorder for years before they're ever diagnosed. The most common reason for this is because the symptoms mimic a lot of other disorders, so it can be confusing, and like a lot of medical doctors, unfortunately, they're not specialists when it comes to POTS. So most of the time, they are just doing multiple tests to try to figure out what you don't have so they can try to narrow it down. If you're watching this video, I'm sure you've been there, and it is extremely frustrating. My first major symptoms were when I was 21 years old, and I was working full-time and going to school at night to be licensed massage and bodywork therapist for pain management. Back then, I was drinking coffee because I've got to stay awake somehow. I had a terrible episode of tachycardia in the middle of class. It was really scary. I mean, I felt like I was having a heart attack. I was shaky. I couldn't breathe. Panic was setting in. Just all of the things. I did go to a doctor and I had an echocardiogram. I was diagnosed with inappropriate sinus tachycardia, which is something that I do have, but I think it comes along with some people with POTS and mitral valve prolapse. And they had come to the conclusion that it wasn't POTS at that time was that I had the tilt table test, which is a standard test they use to determine it. And from going from a laying to a sitting position or standing position while they have you on this table, you were supposed to have your heart rate increase greatly, and a lot of people actually faint during this test. I did not faint, so they said I did not have POTS. You do not have to faint to have POTS. You can have what's called pre-syncope, which is the feeling of going to faint. And you absolutely could faint, but a lot of times people feel that feeling coming on and then they lay back down to prevent it. But don't let them tell you that you have to faint to have POTS, because not everybody does. Your heart rate can increase after you've been standing there for 10 minutes. It can take up to 10 minutes for your heart rate to jump up just out of nowhere like that. So the fact that they a lot of times will do POTS test in an MD's office by having you lay down and then sit up, and then they immediately take your blood pressure or your heart rate, and then they tell you, oh, well, it didn't increase that much. That is not always the case. That is not always the way that they can diagnose it. So stick with your guns and really get a second opinion, and don't give up and don't just listen to that. Looking back in hindsight, POTS flare-up happens a lot of the times when you're under stress, if you've had bacterial infections or certain illnesses, and we've had surgeries, childbirth, and things like that. And those definitely brought out these flare-ups of inappropriate sinus tachycardia in me, not knowing that a lot of the time it was actually POTS. I was on a beta blocker for several years. I was on it off and on because I had to be off of it when I was having my daughter and breastfeeding and things like that. But I did have to go back on it because after childbirth, a flare-up happened again. I went through a stressful period in my life, and I was back on the beta blockers and then got better, off of them again, until finally I had my worst flare-up of POTS ever. This was last fall for me, and it happened in October of 2024. And this major flare-up that I had of POTS last year happened 22 years after the first time, when they told me it wasn't POTS. To put that full story on another video because it's kind of lengthy, but it was quite an adventure, and my pulse rate while sitting to standing suddenly went from like the 60s to 176. At its highest, which is insane. After the first time, it started happening quite often and would interrupt my work, it would interrupt my sleep. It was not just when I was standing up. It could also be in the middle of the night. Like after I had been laying down for a couple of hours, I would wake up in this full-blown adrenaline surge because of the type of POTS that I have. I'm gonna make a playlist of this type of video, so if you are interested in more information about the different kinds of POTS, I'll be able to list that on there for you. But for me, it was an adrenal type of POTS that they call adrenergic, which is a really weird word for just saying that it has to do with my adrenal system, because all POTS is a type of dysautonomia, which is an autonomic nervous system disorder. There can actually be nothing physically wrong with your heart or structurally wrong with your heart, and it's actually part of the nervous system mechanisms that is making you have POTS. While cardiologists are usually the ones that will put you on a beta blocker and treat it, they're really just treating the symptoms of it. A lot of times it's nothing to do with anything wrong with the heart. In conclusion, I am back on a beta blocker. I am on metoprolol. I take 25 milligrams. It's the extended relief. I have to take it before I go to sleep at night because it does make you dizzy, especially in the very beginning when you start taking it. Now my resting heart rate while I sleep in particularly gets down in the 30s. But it does control my heart rate during the day and keeps me from having those surges. I still have to be careful to this day, very slowly getting out of bed. I take my time, I exercise my legs. There's so many things that I do now differently just to maintain. The worst is when I'm out in the garden or something and I will have a really bad habit of squatting down to look at a plant, or I take pictures of things to identify plants. I'm one of those people. And when I do, if I stand up from that, total blackout, like my vision, red, black, everything, and I have to stand there for a while and have someone hold on to me, or I have to lay down or sit down immediately so that I don't faint. And that still happens while I'm on the metoprolol. I mean, it's just something you have to get used to. You have to know what you can and can't do, and you'll always have to do these things to maintain yourself. So that's just a little bit about POTS. I know it was kind of a lengthy video, so sorry about that, but I wanted to thank you for watching if you stuck it out to the end, and hopefully you got some good information. And if you have any questions or want to know anything else, feel free to comment and I'll see what I can do. Have a good one, drink your water and your electrolytes.